Question 1. A licensed practical nurse, LPN, is caring for a client with a new prescription for continuous intravenous infusion of heparin. Which finding requires the LPN to intervene and notify the registered nurse immediately? A. The client's activated partial thromboplastin time, APTT, is within the therapeutic range. B. The client reports mild bruising at the insertion site of the peripheral 4. C. The client's urine appears dark amber and concentrated. D. The client reports a severe headache and vision changes. Answer: D. The client reports a severe headache and vision changes. This question tests the LPN's ability to recognize signs of a serious complication related to anticoagulant therapy, specifically heparin. A severe headache and vision changes are critical keywords indicating possible intracranial hemorrhage, a life-threatening adverse effect of heparin that requires immediate intervention. While mild bruising is a common side effect and dark amber urine could suggest dehydration, neither indicates an immediate, life-threatening emergency like neurological changes do. The LPN's role involves monitoring for such critical changes and promptly escalating concerns to the registered nurse, as client safety is the top priority. Always prioritize neurological changes and signs of severe bleeding when administering anticoagulants. Question 2. The LPN is preparing to administer an oral medication to a client who is having difficulty swallowing. What is the most appropriate action for the LPN to take? A. Crush the pill and mix it with applesauce without consulting. B. Instruct the client to try to swallow the pill with a large amount of water. C. Notify the registered nurse and obtain a prescription for an alternative form if available. D. Ask the client to hold the medication until the healthcare provider makes rounds. Answer: C. Notify the registered nurse and obtain a prescription for an alternative form if available. This question assesses the LPN's understanding of medication administration safety and coordinated care, especially when a client's condition changes. The keywords difficulty swallowing indicate a risk for aspiration if the medication is given as a whole pill. Crushing a pill without a specific order is generally unsafe because not all medications can be crushed, and holding medication until the provider rounds delays care unnecessarily. The most appropriate action is to notify the registered nurse, who can then collaborate with the healthcare provider to get an order for a liquid form or a chewable tablet if available, ensuring client safety and proper medication delivery. Always prioritize client safety and effective medication administration by seeking appropriate alternatives through the healthcare team when a barrier arises. Question 3. An LPN is providing discharge teaching to a client who has been prescribed furosemide, Lasix. Which dietary instruction is most important for the LPN to include? A. Limit intake of all dairy products. B. Increase consumption of potassium-rich foods. C. Avoid foods high in sodium. D. Drink at least 3 to 4 liters of water daily. Answer: B. Increase consumption of potassium-rich foods. This question focuses on client education regarding common medication side effects and appropriate dietary modifications. Furosemide, a loop diuretic, is a key term indicating that the medication causes the body to excrete potassium, leading to a risk of hypokalemia, low potassium. Therefore, instructing the client to increase consumption of potassium-rich foods, such as bananas, oranges, and potatoes, is crucial to prevent this electrolyte imbalance. While avoiding high sodium is generally good for fluid retention, it's not the most important instruction directly related to furosemide's primary metabolic effect. Teaching clients about managing potential medication side effects through diet is a critical aspect of client safety and effective discharge planning. Question 4. An LPN is assisting with the care of a client with a nasogastric (NG) tube connected to low intermittent suction. The LPN notes that the client is reporting abdominal distension and nausea. What is the initial action the LPN should take? A. Increase the suction setting on the NG tube. B. Irrigate the NG tube with 30 milliliters of normal saline. C. Administer an antiemetic medication as ordered. D. Reposition the client to promote drainage. Answer: B. Irrigate the NG tube with 30 milliliters of normal saline. This question tests the LPN's problem-solving skills and understanding of NG tube management. Abdominal distension and nausea in a client with an NG tube connected to suction are keywords suggesting that the tube may be obstructed or not functioning properly. The initial action should be to check the patency of the tube, as increasing suction or administering medication will not resolve a blockage. Irrigating the NG tube with a small amount of normal saline is a common, safe first step to clear any potential clogs and restore drainage, helping to alleviate the client's symptoms. Always assess and ensure the patency of drainage tubes first if signs of obstruction are present. Question 5. The LPN is caring for an older adult client who is experiencing delirium. Which action by the LPN is most appropriate to help manage the client's condition? A. Keep the client's room dark and quiet to promote rest. B. Provide frequent reorientation and maintain a consistent daily routine. C. Administer a sedative medication to calm the client's agitation. D. Restrain the client to prevent wandering and ensure safety. Answer: B. Provide frequent reorientation and maintain a consistent daily routine. This question evaluates the LPN's knowledge of non-pharmacological interventions for clients experiencing delirium, a common and challenging condition in older adults. Delirium is characterized by acute confusion, and frequent reorientation and consistent daily routine are crucial keywords for managing this condition because they help reduce confusion and anxiety. A dark, quiet room might increase disorientation, and sedatives or restraints should be avoided unless absolutely necessary as they can worsen delirium. Helping the client feel grounded and safe through familiar routines and gentle reminders about their surroundings is a primary nursing intervention. Always prioritize non-pharmacological methods to manage delirium and promote a sense of security. Question 6. An LPN is reinforcing teaching for a client with newly diagnosed type 2 diabetes mellitus about foot care. Which statement made by the client indicates a need for further teaching? A. I should inspect my feet daily for any cuts or sores. B. I can walk barefoot around my house to allow my feet to breathe. C. I will wear well-fitting shoes that are not too tight. D. I should trim my toenails straight across after bathing. Answer: B. I can walk barefoot around my house to allow my feet to breathe. This question assesses the LPN's ability to identify incorrect understanding in client teaching related to foot care for diabetes, a critical area for preventing complications. The keyword further teaching indicates looking for an unsafe practice. Walking barefoot is dangerous for a diabetic client due to peripheral neuropathy, nerve damage, and poor circulation, which increase the risk of undetected injuries, infections, and ulcers. Daily inspection, proper shoe wear, and straight-across nail trimming are all correct and vital aspects of diabetic foot care. Always emphasize protection and thorough inspection to prevent serious foot complications in clients with diabetes. Question 7. An LPN is assisting with the care of a pediatric client diagnosed with epiglottitis. Which finding should the LPN immediately report to the registered nurse? A. The child is sitting upright and leaning forward. B. The child has a barking cough. C. The child complains of a sore throat. D. The child's temperature is 100.8 degrees Fahrenheit 38.2 degrees Celsius. Answer: A. The child is sitting upright and leaning forward. This question tests the LPN's recognition of a life-threatening emergency in pediatric clients. Epiglottitis is a medical emergency that can rapidly cause airway obstruction. The sitting upright and leaning forward posture, often described as the tripod position, is a critical keyword indicating severe respiratory distress and impending airway compromise, which requires immediate attention. A barking cough is characteristic of croup, not epiglottitis, and a sore throat or moderate fever are general symptoms that do not indicate immediate airway compromise. Promptly recognizing and reporting signs of airway obstruction is paramount for client safety in pediatric respiratory conditions. Question 8. The LPN is caring for a client who is receiving total parenteral nutrition, TPN, through a central venous catheter. The LPN notes that the client's blood glucose level is 280 milligrams per deciliter. What is the most appropriate initial action? A. Discontinue the TPN infusion immediately. B. Administer a rapid-acting insulin dose. C. Notify the registered nurse of the finding. D. Increase the rate of the TPN infusion as ordered. Answer: C. Notify the registered nurse of the finding. This question assesses the LPN's understanding of managing complications related to TPN administration. A blood glucose level of 280 milligrams per deciliter is a key indicator of hyperglycemia, a common complication of TPN due to its high dextrose content. While hyperglycemia needs treatment, discontinuing TPN abruptly can cause rebound hypoglycemia, and administering insulin is outside the LPN's scope without a specific order. The most appropriate initial action for the LPN is to notify the registered nurse, who can then assess the client, consult with the healthcare provider, and obtain orders for insulin or adjustments to the TPN rate. Always communicate significant changes in client condition or lab values to the RN for proper assessment and intervention. Question 9. An LPN is preparing to administer medications to a client. The client states, "I don't think this is my pill, it looks different than usual." What should the LPN do first? A. Administer the medication, explaining that medication appearance can vary. B. Recheck the medication order against the medication label and the client's identification. C. Ask the client what their usual medication looks like. D. Document the client's refusal to take the medication. Answer: B. Recheck the medication order against the medication label and the client's identification. This question tests the LPN's understanding of medication safety principles and the rights of medication administration. The client's statement, "It looks different," is a critical keyword indicating a potential medication error or a need for clarification. The first and most important action is to recheck the 6 rights of medication administration, especially the right medication, right dose, and right client, by verifying the order against the medication label and checking the client's identification. Administering the medication or documenting refusal without verification could lead to a medication error. Always investigate client concerns regarding medications thoroughly before proceeding. Question 10. The LPN is caring for a client who underwent a total hip arthroplasty yesterday. Which client statement indicates a need for immediate intervention by the LPN? A. I feel a tingling sensation in my toes on the operative leg. B. My incision site is a little sore when I move. C. I had a good night's sleep with the help of a pain pill. D. I am ready to try walking to the bathroom with assistance. Answer: A. I feel a tingling sensation in my toes on the operative leg. This question assesses the LPN's ability to identify a serious postoperative complication that requires immediate action. A tingling sensation in the toes of the operative leg is a crucial keyword indicating potential nerve compression or circulatory impairment, which could lead to permanent damage if not addressed quickly. While some soreness is expected, and good sleep or readiness to ambulate are positive signs, neurological or circulatory changes demand urgent assessment. The LPN should immediately report this finding to the registered nurse for further evaluation, such as checking pulses, capillary refill, and sensation, to prevent long-term complications. Always prioritize neurovascular assessment findings in postoperative clients. Question 11. An LPN is reinforcing teaching about infection control measures to a family caring for a client at home with active pulmonary tuberculosis, TB. Which statement by the family indicates an understanding of the teaching? A. We should wear a surgical mask when we are in the same room as the client. B. We need to ensure good ventilation in the client's room by opening windows. C. It is safe to share eating utensils with the client after washing them thoroughly. D. We will keep the client isolated in their room until symptoms completely resolve. Answer: B. We need to ensure good ventilation in the client's room by opening windows. This question evaluates the LPN's understanding of appropriate infection control measures for airborne diseases like pulmonary tuberculosis. Good ventilation by opening windows is a crucial keyword for preventing the spread of airborne pathogens, as it helps dilute airborne bacteria. Surgical masks offer limited protection against airborne particles for caregivers, who may need N95 respirators if prolonged close contact is unavoidable, depending on healthcare policy. Sharing utensils is generally safe after washing since TB is not transmitted via fomites. Isolating the client until all symptoms resolve might be impractical and less effective than proper ventilation and medication adherence. Reinforcing proper ventilation for clients with airborne diseases is a key aspect of community and home health safety. Question 12. The LPN is assisting a client with a colostomy bag who reports leakage around the stoma. What is the most appropriate initial action for the LPN to take? A. Apply more adhesive tape around the existing pouch. B. Change the colostomy pouch and skin barrier system. C. Reinforce the client's current skin barrier with paste. D. Document the leakage and reassess in 4 hours. Answer: B. Change the colostomy pouch and skin barrier system. This question assesses the LPN's practical skills and problem-solving related to ostomy care. Leakage around the stoma is a critical keyword indicating a compromised seal, which can lead to skin irritation, odor, and further leakage. Applying more tape or paste over a failing seal is a temporary fix that doesn't address the root cause, and simply documenting without action delays necessary intervention. The most appropriate initial action is to remove the compromised system and apply a fresh colostomy pouch and skin barrier, ensuring a proper seal and protecting the peristomal skin. Timely changing of a leaking ostomy pouch prevents skin breakdown and discomfort for the client. Question 13. An LPN is reinforcing instructions for a client taking digoxin. Which client statement indicates a need for further teaching? A. I will take my pulse for a full minute before taking this medication. B. I should call my doctor if my pulse is less than 60 beats per minute. C. I will take an antacid if I experience nausea after taking digoxin. D. I should report any changes in my vision, like seeing halos. Answer: C. I will take an antacid if I experience nausea after taking digoxin. This question evaluates the LPN's ability to identify a client's misunderstanding regarding digoxin administration and its side effects. Further teaching is the keyword. Nausea is a common symptom of digoxin toxicity, a serious condition. Taking an antacid might mask this critical symptom, delaying appropriate intervention. Therefore, this statement indicates a need for further teaching. Correct teaching includes monitoring pulse. Digoxin can cause bradycardia, reporting bradycardia to the healthcare provider, and recognizing signs of toxicity like visual disturbances, e.g., halos. Always educate clients to report new or worsening symptoms, especially those related to potential drug toxicity, rather than self-treating. Question 14. An LPN is observing a newly hired unlicensed assistive personnel, UAP, performing morning care for a client. Which action by the UAP would require immediate intervention by the LPN? A. The UAP offers to shave the client's face without using shaving cream. B. The UAP assists the client with passive range of motion exercises. C. The UAP measures and documents the client's oral intake. D. The UAP delegates bathing a client to another UAP. Answer: A. The UAP offers to shave the client's face without using shaving cream. This question assesses the LPN's role in supervision and ensuring safe client care, particularly concerning UAP activities. Offering to shave a client without shaving cream is a critical keyword indicating a practice that can cause skin irritation, nicks, or cuts, especially problematic for clients on anticoagulants or with fragile skin. While UAPs can assist with passive range of motion and document intake, delegating to another UAP is outside their scope, as delegation is a nursing function. The LPN must intervene immediately to ensure client safety and prevent harm, as direct personal care tasks require proper technique to prevent injury. Always prioritize immediate intervention for actions that directly compromise client safety. Question 15. The LPN is reinforcing teaching about proper use of crutches with a client who has a fractured ankle. Which observation indicates the client needs further instruction? A. The client bears weight on the axillary pads. B. The client advances both crutches and the affected leg together. C. The client uses a three-point gait when walking. D. The client keeps elbows slightly flexed when using crutches. Answer: A. The client bears weight on the axillary pads. This question tests the LPN's knowledge of proper crutch use and the ability to identify unsafe practices. The keyword further instruction points to an incorrect technique. Bearing weight on the axillary pads, armpits, is a dangerous practice that can cause nerve damage, specifically crutch paralysis. Proper crutch use involves bearing weight through the hands, with elbows slightly flexed, and using appropriate gaits. The LPN must immediately correct this unsafe practice to prevent nerve injury. Always emphasize proper body mechanics and weight distribution when teaching clients to use assistive devices to prevent complications. Question 16. An LPN is assisting with the care of a client diagnosed with acute pancreatitis. Which dietary modification should the LPN reinforce with the client? A. A high-protein, high-fat diet. B. A diet rich in simple carbohydrates. C. A bland, low-fat diet. D. A diet with increased fiber and dairy products. Answer: C. A bland, low-fat diet. This question assesses the LPN's understanding of dietary management for specific medical conditions. Acute pancreatitis is an inflammation of the pancreas, and the pancreas is responsible for producing digestive enzymes, especially for fats. Low-fat diet is a crucial keyword here because consuming fat stimulates the pancreas to release enzymes, which can worsen inflammation and pain in pancreatitis. A bland, low-fat diet helps to reduce pancreatic stimulation and promote healing. High-protein or high-fat diets would exacerbate the condition, and simple carbohydrates or increased dairy are not specific to pancreatic healing. Always reinforce dietary modifications that reduce the workload on affected organs to promote healing and reduce symptoms. Question 17. The LPN is caring for a 4-year-old child admitted with dehydration due to vomiting and diarrhea. Which assessment finding is most indicative of fluid volume deficit in this child? A. Moist mucous membranes and brisk capillary refill. B. Pink skin color and strong peripheral pulses. C. Sunken fontanelle and decreased urine output. D. Consistent weight gain and normal skin turgor. Answer: C. Sunken fontanelle and decreased urine output. This question evaluates the LPN's ability to recognize key indicators of dehydration, especially in pediatric clients. The terms dehydration, vomiting, and diarrhea are keywords pointing to fluid volume deficit. In a 4-year-old child, though fontanelles typically close by 18 months, sunken fontanelle is a classic sign of dehydration in infants and can be used conceptually for significant dehydration in young children. Although less reliable for a 4-year-old specifically, decreased urine output is a more universally applicable and strong indicator of inadequate fluid volume across all ages. Moist mucous membranes, brisk capillary refill, pink skin, strong pulses, weight gain, and normal skin turgor are all signs of adequate hydration. Prioritize objective signs like decreased urine output and altered physical signs, e.g., sunken eyes, absent tears, poor skin turgor specific to age group, when assessing dehydration. For an LPN, identifying critical signs like decreased urine output is essential for reporting to the RN. Question 18. An LPN is reinforcing teaching with a client who has a new prescription for nitroglycerin sublingual tablets for angina. Which statement indicates the client understands how to use the medication? A. I will take 1 tablet every 10 minutes until my chest pain is gone. B. I should swallow the tablet whole with a glass of water. C. I will place 1 tablet under my tongue when I have chest pain and can repeat it in 5 minutes if pain persists, up to 3 doses. D. I need to call 911 immediately after taking the first tablet. Answer: C. I will place 1 tablet under my tongue when I have chest pain and can repeat it in 5 minutes if pain persists, up to 3 doses. This question assesses the LPN's knowledge of proper sublingual nitroglycerin administration and emergency protocol for angina. The keywords sublingual tablets and angina are crucial. Placing 1 tablet under the tongue, waiting 5 minutes, and repeating up to 3 doses is the correct and standard procedure for angina relief. Taking it every 10 minutes, swallowing it, or immediately calling 911 after the first dose are incorrect actions. Calling 911 is indicated if pain is not relieved after the first dose, or if it worsens, but not immediately. This proper sequence ensures the client receives effective and safe relief while also knowing when to seek emergency help. Always ensure clients understand the exact administration steps and when to activate emergency services for acute chest pain. Question 19. An LPN is providing care for a client diagnosed with Clostridium difficile, C. diff, infection. What is the most important personal protective equipment, PPE, the LPN should use when caring for this client? A. N95 respirator mask. B. Sterile gloves. C. Gown and non-sterile gloves. D. Face shield and surgical mask. Answer: C. Gown and non-sterile gloves. This question tests the LPN's knowledge of specific infection control precautions. Clostridium difficile, C. diff, is a key term, indicating contact precautions are required because it is primarily spread through direct contact with contaminated surfaces or stool. Therefore, a gown and non-sterile gloves are the most important PPE to prevent transmission during client care. An N95 mask is for airborne precautions, sterile gloves are for sterile procedures, and a face shield/surgical mask is typically for droplet or splash protection. Always remember that C. diff spores are resistant to alcohol-based hand rubs, emphasizing the importance of thorough hand washing with soap and water after removing gloves. Question 20. The LPN is reinforcing teaching for a client with diverticulosis. Which food item should the LPN instruct the client to avoid during an acute flare-up of diverticulitis? A. Cooked vegetables. B. White bread. C. Whole grain cereal. D. Plain yogurt. Answer: C. Whole grain cereal. This question assesses the LPN's understanding of dietary management for gastrointestinal conditions. During an acute flare-up of diverticulitis, the acute flare-up is the key phrase, indicating inflammation of the diverticula. In this phase, a low-residue or clear liquid diet is typically recommended to allow the bowel to rest. Whole grain cereal is high in fiber, which can irritate the inflamed diverticula and worsen symptoms. Cooked vegetables, white bread, and plain yogurt are generally low-fiber options that may be tolerated as the client progresses. During acute exacerbations, it's crucial to avoid foods that might irritate the inflamed bowel. Question 21. An LPN is assisting with the care of a client who has a chest tube connected to a closed drainage system. The LPN notes continuous bubbling in the water seal chamber. What is the most appropriate initial action? A. Clamp the chest tube immediately. B. Document the finding and continue to monitor. C. Assess the client's respiratory status and check for kinks in the tubing. D. Increase the suction setting on the drainage system. Answer: C. Assess the client's respiratory status and check for kinks in the tubing. This question tests the LPN's ability to troubleshoot chest tube drainage systems. Continuous bubbling in the water seal chamber is a critical keyword indicating a potential air leak, which needs investigation. While clamping might be part of locating a leak, it's not the first assessment step. Simply documenting or increasing suction without assessing the cause is inappropriate. The initial action is to assess the client for signs of distress and systematically check the tubing for kinks, disconnections, or loose connections, working from the insertion site down to the drainage system. This systematic approach helps identify the source of the air leak, ensuring client safety and proper functioning of the drainage system. Question 22. The LPN is providing care for a postpartum client 2 hours after a vaginal delivery. The client's fundus is boggy and displaced to the right. What is the most appropriate initial nursing action? A. Administer methylergonavine, Methergine, as ordered. B. Encourage the client to ambulate to the bathroom. C. Instruct the client to breastfeed the infant. D. Assist the client to empty her bladder. Answer: D. Assist the client to empty her bladder. This question assesses the LPN's understanding of immediate postpartum care and common complications. A boggy fundus and displaced to the right are critical keywords indicating a full bladder, which can prevent the uterus from contracting effectively, leading to excessive bleeding, postpartum hemorrhage. The most appropriate initial action is to assist the client to empty her bladder, as this simple intervention often allows the uterus to contract and return to its midline position. While medication and breastfeeding can help uterine contractions, addressing a full bladder is the most immediate and direct intervention for this specific presentation. Always address a full bladder first when a postpartum fundus is boggy and displaced. Question 23. An LPN is reinforcing teaching about fall prevention strategies with an older adult client in their home. Which statement by the client indicates that the teaching has been effective? A. I will keep the lights dim in my hallways at night. B. I should use throw rugs to make my floors more comfortable. C. I will ask for help if I need to reach something on a high shelf. D. I can wear my loose-fitting slippers around the house. Answer: C. I will ask for help if I need to reach something on a high shelf. This question evaluates the LPN's ability to assess the effectiveness of fall prevention teaching in a home setting for an older adult. Asking for help to reach high items is a key indicator of understanding fall prevention, as it directly addresses a common cause of falls, loss of balance or reaching beyond a safe limit. Dim lighting, throw rugs, and loose-fitting slippers are all risk factors for falls. Therefore, statements indicating avoidance of these hazards or seeking assistance demonstrate effective teaching. Always empower clients to identify and modify environmental hazards and behaviors that increase their fall risk. Question 24. The LPN is preparing to administer an intramuscular, IM, injection to an adult client. Which site is generally considered the safest for an IM injection in an adult? A. Deltoid. B. Dorsogluteal. C. Ventrogluteal. D. Vastus lateralis. Answer: C. Ventrogluteal. This question tests the LPN's knowledge of safe IM injection sites. The ventrogluteal site is generally considered the safest and preferred site for IM injections in adults because it is free of major nerves and blood vessels, significantly reducing the risk of injury. The deltoid is suitable for smaller volumes, the vastus lateralis is common for infants and toddlers, and the dorsogluteal site carries a high risk of sciatic nerve injury, making it generally avoided. Selecting the safest injection site is crucial for client comfort and preventing complications. Always prioritize the ventrogluteal site for adult IM injections unless contraindicated. Question 25. An LPN is caring for a client who is experiencing an allergic reaction to a medication, manifesting as urticaria, hives, and mild pruritus, itching. What is the LPN's priority action? A. Administer epinephrine intravenously as per protocol. B. Document the reaction and continue to monitor. C. Stop the medication immediately and assess the client further. D. Apply a cool compress to the rash and administer an antihistamine if ordered. Answer: C. Stop the medication immediately and assess the client further. This question assesses the LPN's prioritization skills when a client experiences an adverse drug reaction. The keywords allergic reaction, urticaria, and pruritus indicate the client is reacting to the medication. The priority action is to immediately stop the offending medication to prevent the reaction from worsening. While assessing further, applying compresses or administering antihistamines are important subsequent steps, and epinephrine is for anaphylaxis. Stopping the medication is the crucial first step to ensure client safety. Always discontinue a suspected offending agent immediately at the first sign of an adverse reaction.